product. I love it because one, I can create it and form it to the cavity the way that I know the lumpectomy was performed and where that tumor bed was. Because I regularly perform oncoplastic surgery, collapsing that cavity, it's really important to be able to show the radiation oncologist where that tumor bed was and where I want them to focus, especially on any boost that they're going to give. Because often we'll make an incision in the lateral breast, the inferior breast, maybe we did mammoplasty, and so using incisions is no longer the way for them to identify the area out, nor is a seroma, because we don't want to leave a seroma. So that's probably the biggest reason, but also for me with clips, even using a few clips, there's a fair bit of artifact. And we want to be able to watch that site, that area, if we want to do follow-up MRIs. I don't want artifact from the clips, even on mammography. So on a mammogram, I don't even want that little bit of chatter that we see from a clip. And so the VeraForm does not cause that. I'm able to mark that area, watch that area, and know that I can see it without artifact potentially obscuring something like a recurrence or something that might be concerning.
Is it VeraForm an important component of your oncoplastic approach?
It's important in that it allows me to really identify the area that I was concerned about, where the tumor was, no matter how I approach it oncoplastically. So for instance, if I do a significant amount of tissue rearrangement, either by myself or with plastic surgery, I'm able to mark, say, the superior and inferior most aspects of that cavity. If I wanted to, the medial, lateral, whatever I want to mark, I get to choose that. I mark that area, and then as the tissue is rearranged, the radiation oncologist can see where those two areas line up. So perhaps they're different, maybe they're right on top of each other, maybe they're a little bit to the side. That really allows them to select the radiation so that they don't over irradiate the field. The boost is a big part of what can cause some of the cosmetic effects. And by doing this, they've actually studied it. We have some great papers out that show there's less radiation delivered to the breast overall with that boost. It's much more selective.
Great. And last question. Tell us about this technique of creating discrete circles that you have championed.
So I love putting in a circle for several reasons. One, when I tie the circle, I can make the knot very tight, and I just do 2 throws. And it's really tight. I don't worry about it coming undone. I don't worry about a big knot, something that might become palpable. And again, it's very quick. So I can put it in where I want it. I can mark that area. And let's say I put in a 2.5 centimeter contiguous circle because the area of the tumor I feel was 2 centimeters and I want to put that in. And then I collapse it. Well, it may look like that, but the radiation oncologist can see exactly where I was looking, and so can I. Often when I see patients in follow-up, the VeraForm will almost have turned into an infinity, I find. But again, it's very nice for me to see how the tissues came together, where the area of concern is. I love it. And it's quick.